Coming up,
Yeah.
animals who need loving homes. And a local hospital offers relief for women with fibroids. It's all ahead.
Good afternoon and welcome to SunCast. I'm at the Lowell Humane Society with Pal. She's just one of the many pets that needs to be adopted.
This is Xerxes, and we have had Xerxes on the adoption floor for over a month. He is a neutered male, and he's only a year and a half old.
Xerxes and other animals need loving homes, but the Lowell Humane Society is up against hard times. Rising utilities and medical costs have left the animal shelters struggling to survive.
We do not receive any federal or state funding. Everything that we do for these animals every day is we run strictly on donations.
Many animals come in with expensive medical problems like Buddy and Sugar who need dental work.
And this is Buddy. He is about 7 years old, and he does need a medical, and he's going to be neutered. And he was brought to us because his owner passed away, and family members couldn't keep him, so they brought him to us. And we're going to get you fixed up, huh? Good boy. This is Sugar. She is about 7 years old, and she was brought to our shelter after her owner passed away. And when we got her here, we discovered that she has very bad teeth. So we are looking to get her teeth fixed, and as you can see, she's super sweet.
Some owners simply can't take care of their pets and leave them at the shelter.
This is Snickers. She is 10 months old, and she's a spayed female, and she was brought to us. Her owner was now working 3 jobs and just felt that Snickers wasn't getting the time that she deserved. Her name is Dawn, and she's called a Dutch Rabbit. That's her breed, and she's about a year old. And she came into the shelter. Her owner just couldn't care for her any longer. It's very difficult for folks to relinquish their animals that they love and care about. And it is difficult on the staff. But on the days that those animals go home, it's really awesome.
Up next, I'm here at Saints Medical Center where Dr. Catherine Olson explains how a new procedure is providing relief for women with fibroids.
A fibroid is a smooth muscle tumor primarily of the uterus. You can get fibroids in your breast. They're called fibromas, but generally speaking, they're in the uterus. And they affect about 40% of women. Most people with fibroids are completely asymptomatic, and they don't have problems. They may occasionally have pressure, but sometimes the fibroids can cause heavy bleeding or pain. The uterine artery embolization is a new option for patients, and it's a way of non-invasively taking care of the fibroids. A small catheter is placed in the groin or in the neck, and they thread a catheter down to the uterine artery. And what they'll do is they'll feed that catheter into the uterine artery, and then they'll put in these little plugs, for a better word, little pledgelets that actually will follow the uterine artery disposition to go to the fibroid. And they'll decrease the blood supply to the fibroids. So the fibroid, it's almost like it thinks it's menopausal. The blood supply decreases and the fibroids shrink. But if a woman has very, very heavy dysfunctional uterine bleeding and doesn't want to have surgery, this would be an option. The uterine artery embolization is not the right thing for every woman. There are certain women that are that are more appropriate for this than others. Because we recently had a patient who had been in our emergency room 5 or 6 times each month after her period hemorrhaging, needing transfusions. I mean, hemorrhaging to the point of transfusions from her fibroids. She had a moderately large fibroid uterus. Culturally, she did not want to have surgery. She didn't want any scars on her abdomen, and she did not want to lose her uterus. It's very, very important for her culturally to do this. And so this was a great option for her to decrease the blood supply so that she doesn't need to continue to have transfusions on a regular basis. It was a language barrier. We went through it, but she was very happy that we were able to do it locally. We would have never gotten her into Boston for the procedure, and she was refusing other surgery, so it was a great option. And the patients that I've had before had very select fibroids where they really weren't a candidate for anything else other than hysterectomy. They want to avoid the surgery, and this is just one more option to avoid having surgery.
Thanks so much for joining us. Have a great afternoon.